the pleasure of being in any rooms, but I've heard that he has a very quick grasp of things. And
I've only met one person like that many years ago on Wall Street. I was an expert on something, and I was hired by the guy that knew nothing, but I found out in 5 minutes he knew more than I did. Like, but he didn't care to study that field. I could do that. It's like, okay.
all right.
Put me in my place.
Yeah. Hi, Schwang. How are you? Hope you're muted.
I'm good. How are you, Carrie?
I'm good, thank you. Nice to see you.
Nice to see you too.
Massachusetts crash stuff. They won't talk about Massachusetts crash.
Nancy D, anybody know her?
Nope, she's muted again. But I heard
Just
something.
muted her because of the background noise.
Paula?
Hi, everybody. How are you?
Hi, Jerry. Hi, Paula.
Everybody doing okay?
Yeah, you know,
Yeah.
new haircut for you, Paula.
Yes, thank you for noticing.
Okay.
Just had it done. Yep.
Very nice.
I'm not getting haircuts while in Florida and become antisocial at the same time, so that's all right. Let's see. Kevin is not going to make it tonight. He sent me a very courteous email yesterday, and
okay.
got family obligations. I think it's vacation week, maybe.
It is school vacation week, yeah.
Yeah.
February.
Going to Cancun?
Yeah,
With Lion
let's do it.
Okay.
Oh, boy.
In which case, I guess we could start. So I'll call the meeting to order. And in terms of our agenda tonight, we'll have public comment if there is any. We'll review the minutes from the past meeting and see if we can approve them. And then the core part of the meeting is around, one is around the health director position, which is going to be posted soon. And so I thought there would be an opportunity for us to talk a little bit about what we'd like to see in a health director. And then similarly, with respect to the whole recruitment process, we ought to talk about what kind of input the board would like to see or would like to have, and how would that fit when the process begins. And then number 7 is I sort of updated the RFP that we had sent out last October to narrow the scope, and I wanted to just see what folks thought about that. Then we have the usual COVID-19 items we'll go through, and then wrap up for any next agenda items. So with that in mind, yes.
If I may, I'd like to request a moment of personal privilege.
Yes.
I wanted to just raise something with the board. It has been a very interesting week for public health, and I have watched with some dismay the way the vaccine rollout has been happening here in the state. And I want to preface this by saying that we always know that there are planning constraints that happen in rooms that we are not aware of, and that it's very easy to sort of quarterback people's decisions without all of the information. I appreciate that. However, I have real concerns about the most recent decision by COVID Command to eliminate allocation to local clinics unless they can do 750 doses a day, 5 days a week. My particular concern, I wasn't happy about this sort of from a professional perspective, because I know that local communities are prepared to provide vaccine to folks. That was really concerning me. Then I had an opportunity today. I took a vacation day and I volunteered at a clinic in another community. And I saw the folks that were being served there. And it became really clear to me that it's important that I would like to ask the COVID Command Center to reconsider their decision about local allocations. The folks that I saw coming in were using walkers, were in wheelchairs, who had limited mobility. They were very tentative about coming to locations. They were hard of hearing. They, had a lot of different barriers that made coming to a clinic challenging for them. And they voiced, because I was doing clinic flow, I was talking to a lot of folks, and they repeatedly said, thank you for having this here for us so that we didn't have to come to Gillette. I don't have a computer. I'm waiting for a ride from the ride because I don't have a car. I, am uncomfortable traveling that far. I think that there are a lot of barriers for people that these large vaccination sites aren't taking into account. And I really want to ask that there be a reconsideration, whether there's a way to do a regional distribution for, age 75 plus and folks with, with limitations in access or things like that. I really think that it's important that we voice this concern. I'm going to communicate this myself. I'm raising this to ask if my board members have interest in having a communication from the board.
I second you wholeheartedly. I am just immensely discouraged by how this has rolled out. And I would agree with you about the elders in particular. I was at the 75 plus clinic, and there were some really frail people trying to get their vaccine.
Yep.
And to have them go for miles,
Yep.
travel for miles to try and get it, it's just unconscionable.
Yeah, I agree. We in the state, we have these local systems, in every town. And,
Yep.
We've been preparing for this for years, and we do flu every year. And so it's not like we don't have the capability. It seems like, if you gave, 20% less vaccines to Gillette and Fenway and Danvers, you could distribute at least a modicum to cities and towns to do it. So, it has been really frustrating, and, I totally agree with you. Bob, did you say that our state representatives sent a letter or did something around this?
Well, I'm trying to remember. Every day is like a year. I think it was last week when we were gonna, or we did ask for more doses, and especially of the Pfizer doses.
Yeah.
I sent a letter in, and they endorsed that. They also spoke in favor of it. Yesterday, you guys know the health region we're in, and I've always taken for granted that we have to work within the health region, although I heard some things today that maybe that's not true anymore. But the health region kind of tried to get together and do something on a regional basis. So, one community was going to lead, and so I quickly said yes. I got another community to join us last night, and so I alerted our reps of that, and they also were very supportive of that. But honestly, the 750 is okay. It's the 5 days a week that,
Exactly.
Reading could do 1 day a week and do 750. Maybe if we're really lucky, we could do 2 days. We don't have the staff to do 5.
Right.
You guys know the setup. We're using school nurses that are available on a Friday, but not Monday to Thursday unless school is closed. So, and most of the communities we're dealing with, don't have large staffs either. And in particular, they don't have paramedics. So it really is a pretty high bar to hit the 5 days a week.
Yes, it is. It's almost an unachievable bar.
So are you saying, Bob, that maybe we could get several communities together, to make an appeal? To
Well,
what you're doing?
one of the communities went in today to do that. I've not heard anything. But away from that community, I heard that two of the communities that they thought were going to join them were no longer interested. So I don't know.
Yeah.
I thought it was interesting that those of you who have been on the board for a while may remember Emmy Dove. She posted she posted an article from the Abington newspaper describing this particular issue about how for years each of these regions have had these emergency preparedness plans and they were ready and willing to go, and all of a sudden got kicked to the street. And how frustrating everyone is, how frustrated everyone is.
Yeah, I can forward that to Peter if he wants to share. I can share it to everybody now with no reply. It's a very good editorial, and it was noted that that was the first ever editorial that Abington paper had written. Never done one before. It's very well written, and very, very accurate.
Yep.
So, okay, so I'm making a motion that the board express to COVID command that they should reconsider the allocation of doses of vaccine to local communities to be able to support vaccination, particularly of their most vulnerable.
Seconded.
And I'm happy to start a draft because I've been writing stuff all week and share it. And so that Richard, you can, as chair, if you want to put your stamp on that, if that's how we want to do that, I'm happy to do that. Is that okay?
Yes.
Okay.
Yeah. Roll call. Carrie?
Yes.
Paula?
Yes.
Rick, yes.
Yes.
So Carrie, the action step would be if you could draft something.
Yep.
I'm not sure exactly what the membership of the state COVID command is, but if you could draft something and then maybe we could take a look at it,
Yep.
Email it, and then we could send it in.
Yep.
Okay, that's good.
Thank you for that.
Thank you.
Thank you. Thank you for joining me. Thanks for listening. Pleasure to serve with you all.
Oh. Happy to get behind you on this, especially.
Okay, is there any public comment?
I didn't get that. Could you try again?
This is my Apple Watch. There's a Siri on it. Jeez, Okay, no public comment. Any comments on the minutes from February 4th?
Nope. I was okay with it.
Yeah, it was okay. Go ahead, Karen.
Sorry, I'm just saying, is that a hand raised there on that? I'm not sure who, is that Laura? 823?
Oh, I guess is that my, oh, that's my hand, I guess.
Sorry, okay.
You got something to say, Rick?
Are you okay with the minutes, Carrie?
Yes.
Yeah, okay. Motion to approve the minutes.
Second,
Second, roll call, Carrie,
yes.
Paula,
Yes.
Rick, yes. Okay. Okay, Health Director job attributes.
I'm going to get some notes I left in the other room. Excuse me.
Okay. So my understanding is that we're likely to post for this position sometime in the next 2 or 3, 4 weeks or so. And there is a formal job description, but Jean, who wasn't able to make it tonight, thought that maybe sending out the substance of the job description, which Peter had done and sent another version this morning, would be a good way to have a conversation about what is it that we would like to see in this health director role. And so, we're not the hiring board. This is the management position. Bob and Jean are the hiring people, but we could certainly have input into aspects of the role that we would like to see. And so, you know, I don't know, Bob, do you want to add anything, and then we can kind of open it up for discussion?
Yeah, thanks, Rick. If you don't mind, I'd like to share a couple things on my screen.
Okay.
Picture's worth 1,000 words. So this document, the charter was revised a few years ago, and this document now is a requirement of annual town meeting. And it's really just an org chart. This is the current org chart from last April/June. I just sort of left the cursor there, and this is where public health is currently. So you can see that, you know, there's 3 elected boards. There is 8 department heads for the town: facilities director, administrative services director, Jean, assistant town manager, town accountant, 2 chiefs, police and fire, DPW director, and library director. And again, there's public health nestled under community services, which is nestled under public services. That's where we are now. And I've said some of these words, but I thought I'd show you in a picture what I'm proposing. And the budget will come out in about 10 days, and this will be a document that's attached to it. I'm proposing to remove health from this public services department, put it under public safety, and it would be the 3rd department head so listed, and it would therefore be a 9th department head. That means all the department heads report directly to the town manager. So, and as a department head position, you know, the compensation, you know, would be certainly adequate. I just wanted to show you that in a picture. Again, you'll see a budget document. There's certainly some details to be worked out. If I can't remember if I've told the board, so I may be repeating myself, but I spoke to both chiefs last summer. They're very supportive of this. I had hoped they would just be open-minded, but they blew right past that and were very supportive very quickly.
That's great.
You know, I talked to Peter before he became our interim director, and he also thought it was kind of a cool idea, I think were his words. So, you know, it's a little different in that most of our department heads have, if you will, more responsibility from a staff perspective. You know, some of the departments are 40, 50, and 60 people with unions. So it's not really the same as those kind of department heads, but I still thought that it was forward-looking enough that who knows what the health department and public health as a field will look like in 5 or 10 years. I don't know. I can tell you it's not going to get any smaller and less important than it has been. And I would assume it's, you know, going to get significantly more important. You know, we have a pretty good integrated organization. So really where it is maybe not as important as the person you have in the jobs, but I think it also makes a statement that Reading thinks public health is important.
Yeah.
And again, at the department head level, that's a whole nother, most towns, Wakefield has like 25 department heads. We have 8. So department head in Reading has some real meaning to it, respectfully. You know, and I look forward to, you know, getting through the discussion, getting a good job description. Because of that proposed change, you know, whatever Jean and Peter have drafted up and you do, I'm going to have to add some things as a department head. So I just wanted to show you that picture. You know, and I will say that the budget that will be put forward in a week or so is almost double what the budget was for health when I first started as town manager. And so that's 6 years, it's doubling. You know, it's a start. Where it needs to go, I don't really know. I think that, you know, a dedicated health director, you know, will have a lot of say in the future of the new department, honestly. And, you know, it's my hope that we can also move this position and this staff into the police department, where everything but fire chief, you know, and EMS are. And, you know, right now, as Kerry knows from the Monday command meetings, this is a very close working relationship between, you know, some of the important functions. And this would not really change that, but it would make the day-to-day stuff easier. You know, you see someone, you talk to them, it's just a more natural relationship. It's just like the superintendent and I used to go to breakfast every 2 weeks without any reason. And that became very helpful because we didn't need a reason to have breakfast. So I just wanted to share that with you before you discuss the job itself.
So it's, I think you've mentioned this in the past, this idea of moving it to public safety. And, from what I've seen from how incident command works, there is a close working relationship between the police and fire and so forth. And so it makes sense on that level. I like the idea that it's an elevation of the position reporting to the town manager, which gives it makes it more likely that we'll recruit someone who sees it that way, as and then I just wanted to ask, this doesn't change the relationship between the Board of Health and the health director? Is
Not
that
a bit.
okay?
Thank you for that picture, Bob. I think that was helpful, and
Yes.
and I agree with everything Rick said. I think that I think it's a good move. I think that it makes sense. I think that particularly we've seen through this pandemic that there's a lot of work that happens together, and it would be useful and important to be on par and co-located. I think that both of those things would be really helpful. So
Agreed.
thank you for paying attention to health like this.
Thank you.
And it's also has the benefit of being in a 24/7 building, which
Right.
is a subtle difference. Plus it has a generator in the building.
Yeah.
So,
All good things.
thank you.
So maybe I'll start off in terms of the bullets that Peter distributed. I just had 3 comments about that. One was under essential functions. There wasn't much said about how this individual would work with the Board of Health. Maybe it's just assumed that that's what happens, but there's really nothing about that relationship. And so I don't think we want to wordsmith tonight. I want to make the point that, and I wrote something, so I'll read it, but you'll get the idea. A bullet could say, supports the local Board of Health responsibilities by participation in all meetings, assisting in agenda development and coordination, and reporting performance metrics to the board on a regular basis.
Mhm.
Identifies areas of concern to the board for policy review and action. So it at least gets the board in there somewhere.
Mhm.
A second comment was under additional knowledge, skills, and abilities. The first one, obviously important, demonstrate a working knowledge of principles of public health. But one could add, and the ability to think and act strategically to promote and protect health and wellness in the community. I think it's really important that this person be able to see the big picture, and if we develop, a community health improvement plan, to be able to understand that in a big perspective and think strategically, as well as tactically. So something about the ability to think strategically. And then lastly, I guess it's also under abilities, skills, and knowledge. There is a mention here on number 4 to communicate effectively, but I might pull that out and emphasize that the importance of having highly developed written and verbal communication skills, because that's like half the job. And so it's mentioned, communicate effectively, but I would highlight it. Those were the only 3 areas that, I might add, and I'd open it up to anyone else who has some thoughts or comments or ideas.
Paula, I know you have notes. Do you want to go next?
No, I don't have notes on this particular.
Oh, sorry. Okay, yeah, Rick, I agree with everything you said. I had noted the piece about the reporting, very much wanting to make sure that was in there. I think that reporting information is a critical piece. I like what you said about the strategic and big picture thinking, and at 100% the communication skills, because that is a critical component, particularly when we talk about elevating it to a department head position. But even without that, I think it was already a very important piece.
Yeah.
I agree wholeheartedly with all of you, both of you.
Jerry, any comments, or you're okay with that? I mean, I think it was pretty well written overall.
Yeah.
Yes.
You're okay with that? Okay. All right. And Peter, you've been working with Jean and Bob on this, right? So you've had input on this.
Yep.
Okay, so in terms of the recruitment process, you know, I had some conversation with Bob, and I've been thinking about this, and it's interesting that it's in order to recruit this kind of position in a city, it's sort of like playing 3D chess, because there's 3 dimensions to this that somehow we have to solve for all of them. And remembering that the goal is that as a board, we want to be sure that the health director we hire, or the Bob hires, is someone who we're comfortable authorizing as our agent and can work with. And so, so that's the goal. The 3 things we have to figure out, the most burdensome is the open meeting law, which doesn't allow for more than one of us at a time, or we can't have a quorum to have a conversation about this. And as I look through the open meeting law, the 10 reasons you could go into executive session, this isn't one of them. And so one issue is that how we work to be in compliance with that. A second issue is the privacy concerns. This is a recruitment of a office, of a position. The person is submitting their, CVs, and so the interview process, or the process that this person has to go through, we have to recognize their privacy concerns. And in not having privacy concerns, could steer away, good candidates. A privacy concern would be, let's interview the candidate at a board meeting on TV. That might not be something someone would want. And then the third complicating factor, actually the least of them all, but understandable, is the simplicity, keeping the process not overly burdensome and complicated. And I worked at an organization for many years where we were notorious about needing to have 10 interviews to hire a position, and everybody sort of joked about, everybody had to have a say, and it just slowed down the hiring process. So somehow between the open meeting law, privacy, but keeping it streamlined, we have to put these 3 things together and come up with an approach. So, I thought of 2 possible ideas, but this is a discussion for other thoughts. One idea would be for us to designate someone to be the board representative in the interview and recruitment process. And I don't know, and maybe Bob, you can fill us in on in terms of what an interview or a recruitment process, who's involved typically. in this kind of position. So the simplest thing would be, let's designate someone to represent the board in this. Realizing that that process would conclude itself and then the other 4 board members would be presented with the outcome. And because of the open meeting law, it's not like we can have offline email discussions about things. Another approach would be to designate 2 board members to participate. And recognizing the open meeting law constraints, if they were 2 full board members, which would represent a quorum, they could interview and give feedback and review, resumes that come in, and just provide feedback independently without conversation directly to Bob or who's ever orchestrating the recruitment process. If it was a full board member and an associate member, then they might conduct the interview together, for instance, on Zoom, because that would not be a quorum, and could have those discussions. I think this is how it works. So those would be my 2 approaches, designate 1 person or designate 2, but keep it kind of separate. I'm not wedded to one or the other, although I do feel that two sets of eyes are better than one. And, one of the good things about this board is that the membership is very diverse. And so you get a diverse set of perspectives. And so, having 2 people rather than 1 might be preferable. But those were my ideas in terms of how we might do this. And I'm sure Bob has some thoughts. Go ahead, Bob.
I'll have to ask about the difference between an associate member and a full member. I don't want to speak to that because I'm not 100% sure.
Yeah.
But I do know that, if you were, let's say you're going to designate 2 members to never work together on different parts of it, review resumes or whatever, that doesn't violate open meeting law, but it does produce a public document so that their application is now a public document. It is no longer private.
Oh, because
Because
really?
a quorum of the board have looked at it.
Right. Oh, I see. Even if the
Even if you didn't do it together.
Right. So a quorum, as I understand it, is two full board members is a quorum. And so even if 2 full board members went through this process, even though they didn't communicate, that would still be considered.
Yeah, again, it's not a violation of open meeting law per se, but it would remove the protection of privacy from the application.
Okay. What about 1 board member? Does that?
1 board member is fine. As long as 1 board member doesn't talk to second board member, it's perfectly fine. And again, I'll have to see if there's a distinction between associates. My gut feel is there's no difference. You're all board members, but let me find out if,
Yeah, my understanding is associates don't have voting power.
They don't, but they're also able to be promoted to vote. So
Yes.
it's not like they're a member of the public sitting in the meeting. So
Right.
I really have to ask.
Other thoughts about this? Carrie, you're.
So who else would be, I'm sorry, who else would be on the interview panel, as it were? Bob, of course.
Bob, who would that be?
Honestly, I'm not this far along in thinking about it. My hair's
Okay.
been on fire.
Sorry.
Typically where it's a department head position, there'll be a number of department heads, even if it doesn't seem to be related to health, they're department heads. I would suppose certainly the fire chief is going to be part of it. And if he's watching now, I'm sorry, I didn't tell you, Greg. I would think we would want a representative from the school department. And then the question is, and we haven't done this lately much, but we used to reach out to other communities and ask for an expert to join us. So for instance, years back when we were hiring a DPW director, we asked the Wakefield DPW director to be part of the search committee. So in theory, you know, and certainly when Peter returns, you know, he'd be part of it. But in theory, you know, we could reach out to any number of current health directors who are not applying for the job, and, you know, potentially they could help.
Thank you.
You know, you just want to limit it to a number that's not unmanageable. You know, normally, from my experience, when you get to 6 or 7, that's about it.
Okay. Carrie, you were gonna
Yeah,
say-
I was muted and I was, you know, this is just a brainstorm. I was remembering something that Anne Landry said when she was first, when we were appointing, the select board was appointing folks to the board, and she was talking about public health avengers. It stuck in my head. And, you know, some other folks in the community that were interested and engaged, but maybe couldn't serve on the board. And I mean, that kind of popped up as, is that a possible, or is it something that you maybe consider a former member of the board, so that there's someone that has some perspective but doesn't constitute a quorum? You know,
Yeah, I would be pretty open-minded, just subject to the how large it should get part.
agreed. 100% agreed. Yes. So maybe a former chair, or, you know, a former member, you know, could be considered. Perhaps one of them might have time.
Yeah, and that's the other part, is we don't, at least I can't really imagine exactly what the process will look like from a time constraint. I will tell you that at some point, if not right away in the process, I want to interview people in person for this job. It's not, you know, we do something initially on Zoom, that's a maybe, but this is too important, it's going to happen in person. And that limits, you know, that constrains the interview panels in some cases.
Mm-hmm.
So, you know, I'm pretty open-minded as long as it just doesn't become cumbersome. And, you know, I think the privacy thing is pretty important. I think your applicant pool is quite different, whether it's public or private.
So what's the next step at this point?
Well, I think that so it sounds to me that one is that we need to have one person from the board, from this board, participate in that process. And then the other comments are, you know, potentially a past member of a board as someone who has experience, some past member of this board would be another option. I kind of like that idea.
Yeah,
I like
that's a
that
good
idea,
one.
I think, a little bit better than the community person, because it's hard to find a community person that, I mean, I've been doing this for 6 months and I'm still learning. So, you know, I'm not sure about that, but I like the idea of maybe potentially a past board member. But I think there needs to be one person from this board. I'm certainly willing to do that, but I also don't feel like I need to be the person to do that. And if someone wanted to jump in and participate, I'm open to it, or if people want to think about it and let Bob know, you know, within the next week, we can do it that way too.
Just to also speak to the time frame, don't rush yourself, because I don't have capacity right now. March is a maybe. End of March is much more likely than the middle of March. We're going into budget season with our finance committee, and it's just tough.
So what do you think the posting would happen sooner?
Yeah,
You're saying the process.
I wanted to talk to you about that. We can do the posting relatively soon, you know, that being a relative term. Normally, we don't post positions that aren't technically on the select board's classification chart, as it's called. all of our positions, almost all of our positions are on this classification chart, the non-union positions, I should say. And the board undergoes a very formal process to change, add, or subtract name or positions to that chart. Peter's an exception because he's an interim health director, so I could add on that what that's called the seasonal chart. For the new health director, you know, I could sort of play games and put it on the seasonal chart at first, but I don't really think I want to do that. So that means in order to have it be a formal job, I have to ask the board to put it on an agenda. It's going to take 2 weeks notification with public hearing notices and so forth. And the board has absolutely no opportunity to do that until April. And I just say that because it's a procedural step. I don't think that precludes you from advertising the job, but certainly I can't hire anyone until that part is done.
Yeah.
Just so you know.
Okay.
You know, what do you think? You know, let's just say on March 1st, we post the job. How long do you think it needs to be posted in today's world? I don't have a good sense.
Until we get someone. But, you know, I sort of what I've heard is that there aren't a lot of, you know, there aren't a lot of people out there in this role, and it could take a while. Jean was saying, you know, it could take 6 months to find someone.
Oh,
Yeah, the challenge is if you're really looking for an experienced person, and I'm not saying that's the only option, you're probably asking them to leave a pretty responsible position right now during a pandemic.
Yeah.
So,
point.
you know, on March 1st, potentially they could think about that for July 1st, but they're not going to think about it for April 1st.
Right.
So I just kind of throw that out there. I think we all just need to be flexible. You know, you don't want to prescribe a process that gets you a suboptimal result. I mean, you know, when the right candidate comes, we'll figure it out.
Okay. So why don't we sort of as sort of next steps for this piece is why don't people think about whether they're interested in participating or not, or if they have suggestions about former board members, and maybe forward those to, I sort of want to, I kind of, around the open meeting law, can't forward them to me.
You can forward them to me or Peter.
Forward them to Bob. And then we will figure out based on responses, like maybe at a meeting, or decide who would be the best person, or who would be a former board member who might participate.
There's another option we can at least put on the table. We can have a process that has, you know, more than one round, if you will. So for instance, if we're going to get 50 resumes, that's a lot of work to whittle it down. You know, if we think there's, you know, 12 or 15 people that should be on this committee, maybe it's really 2 different committees. The first one whittles it down, and then the second one interviews kind of finalists or does something closer to the end. So I'll just kind of throw that out there too. We've done that on occasion, especially when we expect a large applicant pool. I have no idea in this case what that will look like.
So we might have a screening committee with one board member, and then the finalist committee with another board member. So there's a little more participation. I like
Yeah,
that.
I have to think about that, but I may have to ask a lawyer about that, but maybe. It would certainly open up more slots generally.
Yeah. Okay. All right. Anything more on that?
We'll get you, you know, a real job description with all the comments you made. I didn't disagree with any of them. They're all,
yeah.
you know, fine. So we'll get that back to you, I don't know, in the next meeting probably.
Okay.
Well, if you're done with me, I'm going to go snowshoe through the blizzard to get home.
We're done.
That's just for Peter's benefit. Thank you.
Thanks.
Thanks, Bob. Good night.
See you. All right. Moving right along. So in terms of the RFP, I basically went through it, and you know, it was very well written, and I know Kerry put a lot of effort into it. And what I simply did was removed the work piece around national accreditation based on our comments last time, because we're trying to get something that we could get a larger group of consultants to bid on. And I sort of stepped down some of the requirements of the consultant to make potentially a bigger pool. And that was about it. And as we talked about last time, this is not something we're going to do right away. We're going to look over the next couple months, see how this health director thing is playing out, and then make a decision. If it looks like it's going to be a 6 or 8 month process to get someone, I think we should just do it. You know, if it looks like we get someone sooner, then maybe we could do it together with the new health director. But we'll just have to be flexible. So any comments on the red line document?
I didn't have any. I liked your changes. You know, I think we were a little, yes, hopefully I think these changes will hopefully increase our pool. And perhaps, you know, make it a more, make it seem like a less significant project than the original bid that we saw. I think that wasn't our intent. So thank you for doing the work.
Sure.
Both of you, yeah. I just had some language that I didn't understand.
Okay.
So for example, on page 6, which I'm trying to pull up myself here, number 5C, it says valuation. And I didn't know if that was the word you wanted or evaluation. I hadn't heard that term before. So I was just looking to see. Are you finding?
What section is that under, Paula?
It's page 6,
Yeah.
part number 5, C.
5C.
5C.
I'm having trouble finding it myself on my phone. I could find it on my computer, but not on my phone.
I see the 5, but I don't see C. So I'm looking for valuation.
I mean, it might be the right word. I just hadn't heard the term before.
Yeah, no, I can't spot it. Let me search and see if I can find it.
And I'll try and pull it up on my computer too.
Yeah.
On page 9.
Is it on page 9?
Yeah, 5C on page 9.
Oh, I'm sorry.
Twice.
5C.
On page 9.
I'm sorry. I thought it was page 6.
That's okay.
And it's used in C and D.
Ability to the proposal identify major tasks in the
And the valuation.
Is it, am I looking at the right one? Is it the red line 2921?
I'm trying to pull it up on my computer. I can't tell you.
The one I sent you, Carrie, I have it here.
Yep, I see it too.
It's a
I can share.
good catch.
No, no, I wasn't trying to catch anybody. I just was seeking clarification.
So it's this area here under 5. It says ability to perform within time constraints. The proposal will identify major tasks in the valuation engagement.
Got it. Oh,
And it says
Is that the word you want?
yeah, I don't know what that is.
That's, yeah, so
I think it may be evaluation.
that's what I thought.
Yes, yes,
Okay.
yes, good catch. Thank
Okay.
you.
No, I wasn't, yeah.
That's, yeah, that's good. And
And
sorry,
then I had another language clarification on page 20, part D.
Page 20.
I just did not understand what was trying to be said. Page 20, yeah, Part D.
Okay.
Oh, that's why.
I'm trying can you see this right now?
Now I see
Yes.
contract. Yep.
Yeah.
Automobile liability?
No,
I'm
Which,
not,
sorry, what
Well-
was the item again?
Page
Part-
20, Part D.
yeah,
I'm looking at that and it's talking about automobile liability insurance
Yeah.
no,
applicable
that
for any
wasn't it.
contractor. Okay.
that wasn't it. I am sorry. I can't. Go, maybe number, Part D, where is the Part D?
Confidentiality
on
on the next page.
20.
I thought it was page 20.
Okay, let me take a look, because when you're sharing, it doesn't tell you what page you're on.
Yeah,
Right.
no,
You
you were
gotta click it.
definitely on 20. Well,
Just
you were on
click
what
it.
I had for 20.
Page 21 talks about, on Part D, talks about confidentiality. Does that ring a bell, Paula?
No, can
Okay.
you read the sentence?
The vendor shall not, without the town's prior written consent, release or disclose any information relating to the project to anyone except as necessary to perform its duties. You're on.
No, that does not sound familiar.
Okay.
I'm
Huh.
trying to pull this up myself and I'm not having luck, and I'm sorry, so we can just move on.
You know, maybe what you could do is, Paula, if you can, you know, somehow get a, I mean, I think you're right
Yeah.
about valuation. Those two
Yes.
words should be evaluation.
Yep.
And if you find those other areas,
I
can you
will-
send
I
those
will
to
follow.
Peter?
Yep.
And Peter can just sort of correct the document.
Oh, yeah, maybe I found it. I think it's sorry. Page 19, no compensation for certain services? No?
No,
Okay, all right, never mind.
I'll find it. and
You'll find it
I'm
and
sorry.
let me know. Yeah.
Yeah, I'm sorry to take up your time.
No
No, it's
problem.
okay.
No, but if I may, Mr. Chairman, let's see, this struck me as a boilerplate that was
Yes.
revised.
Yes.
And so I glared at it for a while, but you know, wasn't about to reinvent this darn wheel of ours here.
Yeah.
You know, so is there a source that
Yes.
this came from? Okay.
Yes, so this
Sure.
came from, so I had started it and then we worked with Allison, and I'm not remembering her last name. Jackie could probably help us. Allison from
Jenkins.
procurement, Allison Jenkins, yes, yes. And she used exactly that, Peter. She pulled out a boilerplate contract. We removed some stuff, then we
Okay.
laboriously removed some more in a meeting. But I'm sure we didn't get it all. Just because it's a long document and.
Right. And I didn't even look at the boilerplate section, which
Yeah.
was like it was like 70% of the document was
Right,
blah, 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 legally.
right.
Yes.
I just looked at the section that described what we wanted. But again, Paula, if you have any comments, maybe.
No, I will.
Would it be better to actually send those directly to Jackie? She has the document. And she could just add those red line.
Okay,
Okay.
Yeah.
That would be great, Jackie. Thank you.
thank you, Jackie. I'll be in touch.
Yeah, because every time I read it, there are other things I'm like, huh? Upset limit is where I'm kind of stuck right now.
Yeah.
If you look at it for a little while, you get tangled up. But as Rick says, we did try and focus primarily on our priorities, and try and weed out the things that would not apply. But Peter, you've probably seen more of these than we all have collectively.
I can't remember seeing it, something like this. I did
Okay.
note some omissions that I would like to see included in there.
Oh,
And I
okay.
don't need this kind of legalese to get through the day. I really don't.
Yep.
So, you know, we're not in a hurry to, well, what is your timeline? I guess we have that document.
Yeah, it's not, this is not an urgent thing because we're, as I said, we're gonna be waiting and figuring out when we would want to issue it. So I just wanted to kind of do this, some preliminary work on it. So let's move on to the COVID updates. And I'll turn that over to you, Peter.
Okay, thanks on that. And, you know, my last email, I hope everybody got it. It was a last minute ditch by Christine, which, you know, I support her in every way.
Absolutely. I hope everything's
She
okay.
had something
Yeah.
going on and she needed to go to it. So she left me with a good report, but no verbiage. So I offered that, and you know, that if there are any questions, I'll record them and get the answers for you separately. But those are the numbers, and you know, I don't really have much to say about that. On the other hand, as I stated in my email, Huang has a great presentation. I think I put, you know, quotation marks at it, slick. That hopefully wasn't a demeaning term, because she's doing a great job for us. And when somebody comes up with, you know, reports like this that are easy to understand and concise, then, you know, I get enthusiastic about it. So I'd like to shift if we can. You want to talk about the numbers? That's fine. I don't have much to add to it. I don't have anything to add to it, actually.
Yeah, I don't, you know, the only thing I would say is it's great to see the case count coming down.
Yes.
You know, it's come down further than earlier in the week. And it's just amazing that we've had 0 influenza reported this year compared to last year. You know,
Yeah.
it's
It really is.
crazy, crazy. But
Does
otherwise,
it make sense, though?
yeah,
Yes,
it does.
absolutely.
You know? Yeah, if we did this every year, we wouldn't have influenza reports. It would
Well,
all be
it's
crazy.
something to do with the germ theory that took a long time to make its way into humanity. But
Yeah.
you know, it's more proof of Louis Pasteur.
Yes.
So we can move on to the vaccine piece, just so that everybody knows, you know, we did, or Peter did, request 1,100 doses last week. And as Bob alluded to, we requested 1,000 of the Pfizer doses, thinking that maybe because of the deep freeze and the cold logistics there, that maybe we'd be more lucky getting them. And apparently something was worked out with Melrose Wakefield Hospital to store them if we got them, and 100 doses of Moderna. So, and the state, like we talked about earlier at the beginning of the meeting, just said 0. So, not that we didn't try.
Right.
But I'm just dying to see this presentation, Shrey.
Of course. Thank you, Dr. Lopez. And I'm gonna share my screen. Okay, so now I'm going to talk about some updates of our COVID vaccine clinics in Reading.
Yes.
And I'm going to talk about where are we right now according to the latest Massachusetts COVID vaccination phases eligibility status, and how many people in Reading have already got vaccinated, including first dose and the second dose. And where is the location and how does the interior look like of our vaccination sites, and how PerkMod helps participants make their vaccine clinic appointments and avoid crowd gathering at the vaccination sites. And last, I will talk about our vaccine weekly order and the town of Reading vaccination capacity. So this is the latest phase 1 and phase 2 eligibility status of COVID-19 vaccination in Massachusetts from MassGov. And currently, Reading has already started phase 1 and phase 2 group 1, 75 plus senior vaccination. And our first responders and health personnel have got their second doses. And starting from today, February 18th, individuals 65 plus and individuals with 2+ certain medical conditions are eligible to get COVID vaccine. And this is the vaccine tracker in Reading. So this is the number of people in Reading already got vaccinated, including the first dose and the second dose. So till today, February the 18th, our first dose vaccinations are 262, including 164 in phase 1 and 98 in phase 2. And meanwhile, 95 out of 164 recipients received their second dose. And here is the detailed number of first dose and second dose vaccinations on each clinic days. And as you can see, the total first dose vaccination is 262, and the total second dose vaccination is 95. And in Reading, we run the vaccine clinics in Pleasant Street Center and the Reading Memorial High School Field House. And here is Reading Town Hall. We run small to medium-sized COVID vaccine clinics in Pleasant Street Center. And this is the interior setting of this vaccination location. We have about 3 nursing stations at this location. And last Friday, February the 12th, we vaccinated about 100 participants within 5 hours. And in Reading Memorial High School Field House, we have a relatively large vaccine clinic. In this location, we can have a maximum 10 nursing stations. On February 5th, we had 3 nursing stations and vaccinated about 70 participants around 4 hours. We only used the 30% capacity of this location. So if we have 10 nursing stations, we may vaccinated 200 to 250 participants within 5 hours. And vaccine clinic appointments for participants. So starting from February 5th, we use PubMod to help participants make their vaccine clinic appointments online. And as you may know, PubMod is an online clinic management and appointment scheduling system. And until now, we had 4 clinics that used PubMod to schedule appointment time and manage our clinics. And for example, so after the participants fill out their demographic and health insurance information, answer the health screening questions, sign consent forms, then they can select a time for their vaccine clinic appointment. You know, because of PubMod scheduling system, it helps to avoid crowd gathering at the vaccination site. And vaccine order and vaccination capacity in town of Reading. So currently we submit a weekly vaccine order by every Tuesday afternoon. And like Dr. Lopez just said, our vaccination capacity is 1,100 doses every week. And this week we ordered 1,000 doses of Pfizer and 100 doses of Moderna. And however, we're not sure if the state will approve the order. And as you may know, Massachusetts is experiencing vaccine supply shortage currently. So as long as the state delivers vaccines in town of Reading, we are fully prepared to finish these vaccinations within 10 to 30 days. And last, it is a real pleasure to acknowledge our fire department, all town nurses, school nurses, and volunteers from different departments in town of Reading working together to make our COVID vaccine clinic a success. Thank you very much. Do you have any question?
I have one, Sharon.
Yeah.
These were only for Reading residents, correct?
Correct.
Okay.
This was great, Chuan, to get to see it all pulled together. I really appreciate that, and I love that you have the names of all of the folks, because there are so many people involved in this. It really is a cross-departmental and cross-town collaborative effort. It takes a lot of work, and collaboration takes a lot of work. It's a lot of effort, especially if you don't always collaborate. So it's nice to be able to acknowledge all of those folks. So you had said that we could vaccinate. So if we received, I just want to check your conclusion. You said if we were to receive the 1,100 doses of Pfizer, that we could successfully vaccinate within 10 to 30 days. Is that what I understood?
Yeah. If like we can have the vaccine,
yep.
We have two different vaccination sites. One is the Pleasant Street. It's for like small to medium size clinic, and we have the Memorial High School field house. That's a large site, so we are fully prepared for vaccinate the amount of vaccines that states delivered to us.
Yep, and that's first and second doses. Is that what your planning assumption is, or not? I just want to make sure I get it right.
You mean the 1,000?
Yeah.
100. That Peter, do you have a better idea for that?
Well, let's see. I'm going to go back to Kerry. That was a good, point that you picked up here, because I'm sure that the fire department believes that we could stay on track to do 1,100 a week. And I was doing the quick math earlier today when I heard this presentation about the number of people that would be in phase 1 and phase 2. And if we could do 1,100 a week, that means we're doing, in the 30 days that Sean just talked about, we could get like 5,000 people done at that time. Now, I don't know what percentage that is of our population that would be qualified for it.
Right.
But I'm not sure at this point what you meant by the 30 days either, Schwang. So let's go back to the assumption, and I know I will get the support of fire department that they could do 1,100 a week. That's what we talked about when we were ordering it. And I have no doubts about that either.
I agree.
I ask about the field house, because I thought I heard you say that you thought that in the field house we could do 250 in a 5-hour clinic. Is that right?
Yeah, because on February 5th, we had 3 nursing stations, and we vaccinated about 70 participants around 4 hours. And we only use 30% capacity of this location. So if we have 10 nursing stations, which is the maximum number of nursing stations that can be in the field house, so we may vaccinate about 200 to 250 participants, like within 5 hours.
So how does that jive with, let's say we got 1,100, are we thinking, or is there discussion that gee, if we got 1,000 vaccines per week, we could administer 1,000 per week, or as Peter said, 4,000 or 5,000 a month. But it doesn't, but that would require, based on the Fieldhouse experiment, that would require vaccinations 5 days a week. Is that right?
No,
Am I missing something?
yeah,
Yeah. Paula was there. They were going so slowly
yeah,
and deliberately. We could do
Yeah.
more. I mean, I think we were giving 10 minutes or more between vaccines. And, the models that we're seeing popping up over the state is we could be doing it much quicker than that.
Yeah, 5 to
Half
7
that.
minutes.
5 to 7, yeah, and I actually was able to be there too, and that was the comment that I got from, I talked to a few of the vaccinators, and they're all saying they could go faster. So I think what Schwung's identified, you've got sort of, this would be a minimum that we could do. We proved that, and arguably we could speed it up some more. I think one of the things we talked about is it depends upon who it is, and it depends upon how long it takes folks to move through the stations.
Right.
The setting up for proper distance means that you do get a little bit of walking, and that can take longer.
But it
But
sounds like they thought we could go twice as fast. in
Correct.
which
Oh,
case-
easily.
Oh, yes.
Absolutely correct. And let's bear in mind, we were experimenting with Prep Mod.
Mhm.
We had first-time folks there all over the place.
Yeah.
All the, most folks that were there, and I wasn't one of them, had never participated in vaccine administration before.
Mhm.
So it was deliberately going slow at half speed.
Mhm.
So
Right. And plus it was a 5-hour clinic and 4 hours.
Or
So it could have been 8 hours, in which case going twice as fast. And then
I'm
There's
sure
1,000.
it could go much
That's the
faster.
equation right there. Double the numbers, double the time, you're 1,000
right.
in one day.
yeah. It's definitely possible. I have some notes from my experience at the clinic today that I'm going to share, because really the rate limitation is is at the end, because people don't want to leave until they're registered for their second appointment, and you really need more people to be more to make that happen. People need some help. So it's kind of interesting to see. But that's not about your throughput. Those folks are done.
Right.
They're complete. That's just a question that comes up of how do you help those people? And I've heard the same question come up at I know I've heard people talk about that at Foxborough. It's just a little bit of a puzzle. Some folks will not leave until they have that appointment booked. Some people are more comfortable with going home and getting a message and booking it themselves. So
People have to wait 15 minutes after their vaccination anyway. So presumably scheduling the second vaccine happens during that 15 minutes.
well, and that was the model where I was, and with PrepMod, and today was notably terrible. But it was taking a good 20 to 25 minutes to get the registration for the next appointment
Oh, gee.
through. So that was challenging. Hopefully, some of that was having to do with the system being very slow, because it was down for the first half of the clinic, and then when it came back up, the demand was super high.
Yeah.
But yeah, that was a real rate limiting factor, and it did mean that we were extending people's waiting periods beyond that 15-minute in some instances. So I'll share that with the planning group, just kind of thinking about how we incorporate that piece, and what our strategies, what strategies we used, what I saw, and what folks want to think about for other ones. But this information about what we've accomplished so far and having it all pulled together was really helpful to see. and shows what we can build on.
Absolutely. Nice job on the presentation. You do much better
Thank
with
you, Swan.
PowerPoint than I do.
Yeah,
No, I was
Thank you, Swan.
watching that go, oh, how does she do that?
Thank you, like it.
So let me just pipe in here as we wrap up. This prototype exemplifies exactly what we can do in terms of communicating the data. We know from Kerry helping us learn that, the percentage that we're being given from the state can be used. I have no doubts. If Greg Burns was here, our chief of the fire department, he would be adamant about we can rise to the occasion.
Yep.
Haven't even broken a sweat yet.
Yep.
But Schwang's job here is communicating and keeping in touch with the stockpile of the vaccine as it comes and goes, and she's doing good work, I think.
Yeah.
Good job, Swan.
Thank you.
Thank you. Any updates from command? I heard that they still wanted to get the addresses of active cases. Is that the case?
So I read through those notes, and I know I was rather vocal about sharing private information with them on an unlimited basis, but I'm getting conflicting stories about the availability of PPE. Now they're claiming that there still is a shortage of PPE, which would make sense for them to have that information on a regular basis. I don't know if anybody can enlighten me any more than that.
I can try to get I think the question has to do with the availability of protective equipment and personal protective equipment. And I haven't an idea on that other than to go to the source and talk to fire squatters and find out what the stockpile is for that. I can certainly get that for us.
And yeah, and I think then there's a further question sort of what is what standards are appropriate and required, and do we have the right supplies based on what's required? Yeah, and how to communicate the information. Yeah, I was encouraged to hear that there's the option to use the report direct from Maven. It's nice that they have that that piece. I think we just have to sort out some of the frequency questions. Yes, it was very, very, very clear. Very clear that they're very interested in continuing to receive that information.
Anything else from Incident Command that we should know about, or other? I mean, the notes were helpful, the minutes. So
the only thing, there's sort of an open item that I just want to flag that so in addition to the folks from, so 75 plus, 65 plus with 2 morbidities, others with 2 comorbidities. There's also eligibility for residents of affordable elderly disabled housing. And that actually comes in from a different supply. There's a federally designated supply for residents that qualify for that. So it's kind of an outstanding question of how the folks that reside at Sanborn Place and Frank Tanner and others, how are they being covered for vaccine? It's a little bit of a different arrangement because the residences have been contacted and asked to reach out to ask for assistance in arranging for vaccination. So they call it like finding dance partners. So we know about this, and it had been on our list. So it's just a question of whether they've reached out for help. Do they have do they have help, and how would we go about doing that? As Shrung has shown us in the presentation, we're absolutely capable of delivering vaccine. We just need to coordinate with that particular population. and make sure that they're served. So that's on my list. And I will say too that there was some work, even though command didn't meet this week, we sort of continuing work on the website to try and clarify the language and indicate who is currently available, currently eligible. So that does continue. It's nice to see that concerted effort to communicate some accurate information as things change.
Mr. Chair, did anybody get the code red call before the meeting?
I
tonight?
did.
Yes.
Oh, that's what that was.
So that was a special meeting that was called to order this afternoon by Bob, and there were just a few of us there and trying to just hammer out a code red message that said we have nothing to report.
Oh,
And it's
that I
almost
didn't
a
get.
null effect, as I understand it to be. But, usually they're saying that there's a snowstorm and your trash is
Right.
going to be delayed by a day. That's a message. The message tonight was there is nothing we can report on. We continue to get inundated with calls, and it's frustrating to the staff. And so we felt that getting a message out saying we don't have answers right now, but the watchword was vigilance. And I was glad that that was inserted into the message, because that's what we're doing. We're every day and in every way we can come up with, finding, we called it a multi-prong effect. I had other names for it too, rattling the cages,
Yep.
which is kind of not appropriate, but any way we can get a message through to going up the line to get the vaccine down, and the residents need to know that we're not sitting on our hands.
Yes.
We're doing everything we can in a vigilant manner.
Yes.
I think a real problem is the fact that the state, as I understand it, hasn't totally pulled out vaccine from all communities, but there are sort of higher risk, higher incident communities, where they are providing vaccine, or maybe they're in the western part of the state and they're remote, where they are providing vaccines to the health departments. And then when you go online, you see Malden, clinic, or Chelsea or whatever, Lawrence. And so people are, it's confusing the issue, because people say, well, those cities in Wakefield, those cities and towns are getting something. Why aren't we getting something? They don't see that, large numbers of towns, in fact, are not getting anything either. They just see the ones where the clinics have been put up on PrepMod. There's nothing we can do about it, but I think it's, I think it's part of the bigger problem we discussed early on. Go ahead, Carrie.
And I'll be including reference to that in my letter, so
Yeah.
part of the inconsistencies and the confusion. I got to tell you, the messagings from all of this, a public health emergency is always both a emergency and then a risk communication and a communication issue. And we don't always do a great job with our communication messaging for public health globally. And I keep saying it's the one thing that's going to drive me back to a PhD program, because we've got to do better with the communication pieces.
A nightmare.
It's really hard. I actually WBUR sent a message out, and I got an email yesterday saying, I don't know, it's 65 plus, you can schedule appointments today. And I was so mad at the headline that I replied, and it was in between meetings, and I replied and I said, this is bad reporting, that's not accurate. And they actually replied to me and said, but the letter says, I said, you can register for an appointment, but there's not going to be any same day appointments, and there's not going to be any vaccine. This is hard. It's complicated. There's a lot of moving targets to it, but I agree that the message plus the inconsistency when folks go on and do try and register is very confusing. And I'm glad that Bob pulled together a group to have that message go out so that folks know that, we don't have information. It's not because we don't want to be issuing the vaccine. We're ready to, we'd like to. And, you know, we'll continue to do what we can to do so, or provide information about the best way that folks can get it if we can't do that ourselves. So, sorry, speech, but inconsistency goes in my letter too. I think it's really hard for everyone.
Any civic or recreational? I don't think there were any, Peter, any civic or recreational issues.
Yeah, you know, does anybody remember if I reported out on the Girl Scout cookie permit that I received 2 weeks ago?
You talked about meetings, Girl Scout meetings,
Yeah,
but not,
meetings were there, but the Girl Scouts want pulled a permit. They want to hold a sales event, but they've taken it right from Girl Scout manual that is updated. It's not the manual. It's got to be one of the periodicals and it's called the shuffle. There were different models, but they're going to be using the shuffleboard model, where you are using a large board and mallets like you would use on a shuffleboard, if that's what they call, to pass the money back and forth and the items back and forth. I thought that was kind of, you know, typical for scouting. They think things through to degrees that the rest of the public isn't. And you know, I give a lot of credit to the leadership in Reading of scouting. You've heard me say before that I'm a large advocate, or a big advocate, for scouts. I think they are the future leaders. And in Reading, we see members that take up the leadership of it, and I think that's great. It's really active. They've taken the town forest in this weather, and they want to do events outside. When I was a scout, there used to be Klondike camping. We learned how to camp in the winter, but it was brutal. And trying to find adults to steer us along was tough, but these guys are doing a really good job. So there's that piece. Those are the Girl Scouts. And since then, we've had one other application for another campfire up at the town forest, and that one's not completed. I'll push a couple of buttons later. I had a little glitch on the permitting process, but we'll get that together in time. So,
Okay, good.
Slow time of the year, but it's still you here and there.
Good. Paula, any update on the restaurant piece?
yeah. Laura has gotten through about 55 of the 132.
Oh, good.
And most of them have been the same response that, yes, we already have this information, thank you. And she reviews protocol with them. And they said, yep, we've been doing it for a year, and they're happy to have the relationship with her. And they have their cell phone. She has given them their cell phone, and they appreciate her being available to them. So it continues. There haven't been any glitches. One restaurant asked if they could have a St. Patrick's Day party. I won't say which restaurant that was. They were joking.
They were joking.
Good. We like senses of humor.
Yeah, you know, there's anecdotal stories that I receive from time to, and I did today. It was a restaurant that was close to Reading. It wasn't in Reading, but the line was coming out the door, and every seat was taken in the shop. So, you know, I've been in the business, that side of the business, you know, for a long time, and you know, we want to support our businesses. There's no doubt about that. But let's face it, especially when times are tough, you do what you have to do. And it's got to be difficult to turn people away when they're at the 40% mark right now, is what the state is saying. It's a burden. And so on weekends when town hall is closed, it's like, go for it quickly. I'm not saying that's what's happening in Reading.
Yeah.
But there's this kind of friendly reminders, I think, is still important enough.
Okay,
Yes.
I will pass that on.
Yes.
I do think it helps for the restaurants to know that we're interested and connecting, and that has cachet in itself.
Okay, I will
Agree.
pass that on to Laura.
I agree
And-
very much. Yeah.
And Florida, by the way, has this kind of wild reputation around the COVID work, between the governor and the parties and the beach and all that stuff.
It's a fact. I'm lucky. I have a spouse that's not very wanting. We seldom, we have our outside activities, but if they do not include crowds, that's for sure.
Has
But
anybody
they're
tried
there.
has anybody tried the igloo restaurants?
What's the name of it?
The what?
Igloo
Igloo?
restaurants that have igloos. They're like geodesic domes.
Oh,
really.
I've seen
Okay.
pictures of those, yeah.
Yeah. I haven't tried them, but I hear those that people have been pretty happy with those.
Yeah.
Yeah.
Okay.
Yep, there's been some very creative things trying to, get seats. So
Hopefully we can open it up. They can open it up more soon if
Mhm.
things stay calm.
Well, if the numbers keep going.
Yeah.
then maybe.
Right.
All right, so our next meeting is March 4th, and it's the first Thursday, so we'll be looking forward to the monthly report from Peter. Peter did send out, based on our comments, a draft mock-up of what the report might look like. And
Yes.
so I'm hoping that over the next couple months, we can begin to populate those cells and fill in the text areas so that we have a standard report that we get each month. And I think it'll be great when we get to that point.
Yeah.
I'm not sure,
had-
other things, if there are, go ahead, Paula.
Just, I wanted to let the board know that, or ask permission rather. I am going back to instructing nursing students in community health, and was hoping it would be okay with you if they just tuned into a meeting just as part of their educative process.
Oh, absolutely. That'd be great.
100%.
Yeah.
Not sure when that's going to happen, but we also may be involved in the pool testing in the schools.
Yeah.
Good.
Very good.
Good.
We're working out contracts right now, so nothing's written in stone.
Okay. Yeah, they're more than welcome.
Thank you.
All right. Motion to adjourn.
Second.
Okay, roll call. Paula. Carrie.
Aye.
Yes.
Rick, aye. All
Thank you
right.
all.
Thank you, Al.
Thanks, everyone. Nice
Thank
job.
you, everybody. Stay
Have a good
warm.
evening.
Stay safe.
Be warm, stay safe.
Thank you.
Bye-bye.
Bye-bye.